So the station one will be on the screen shortly. Dr. Darshit, you can be ready to read it, and the remaining doctors can also read it. Okay, Dr. Darshit, I've given you the permission to unmute yourself. You must be able to unmute yourself. Try again. So okay, just a minute. Okay, unmute yourself now. Okay, so
Yes.
this time that you have outside the cubicle, okay, to read the station. So use this time to make an approach in your mind, at least. At Am I audible to other doctors? Dr. Amrita is saying she's not able to hear me.
Yes, we can hear you, doctor.
Okay, so yeah. So what I'm trying to say is that outside the cubicle, make an approach in your mind. Okay. Usually, these days they are putting vague stations, like they won't, like in this station you don't know what is happening. The only thing that you can figure out it's a pediatric station. Okay. So if you have read really well, so you might be able to figure out, okay, all the pediatric cases that are there in the exam. So usually it comes from the whatever is there. In case the complaint is mentioned, then you should be able to draw a plan for that symptom, how to explore that symptom, and what are the possible differentials. This much you must do outside the cubicle. If you are like, oh, let's leave it to the god, let's see whatever happens inside, then you will struggle. Okay, you have to actively start thinking as soon as you read the question. Okay, don't outside 1.5 minutes is very very important, so do some brainstorming outside the cubicle. So you should practice like that. So now we will begin. I will put the timer shortly.
Take it.
Okay. Can you hear Dr. Darshit?
Yes. Yes.
Okay, you can start.
Like station or?
Yeah. The station has started. You can start now performing.
Hello, I'm Dr. Darshit, and my GMC number is 1234567. Hello, I'm Dr. Darshit. I'm one of the doctors in the GP practice. May I know your name, please?
Yes, doctor. I am Sarah, and I am here for my child, uh, Anna. She is 3 years old.
All right, Sarah. So, can you tell me what is concerning you?
Well, I am really frustrated. It's been now 3 weeks that this Anna is not, eating properly. She's throwing the plates away, and I'm a working woman, and it's not easy for me to manage all these things, So I want to know what's happening to Anna suddenly, how she's behaving like this.
I can see that you are very distressed about this. But now that you have come here, we are going to manage everything. Okay. So, can you tell me more about it?
Yeah, doctor, like I told you, it's been 2, 3 weeks now, and she's throwing these fits. It's happening almost every day. She doesn't go to sleep properly. Like she comes out of the bed in the night, and I am not able to cope with this.
All right. And before 3 weeks, was she absolutely fine?
Yeah, she was fine. Yeah.
All right. And you said that it happens during daytime also or only nighttime?
It's happening like throughout the day, sometimes in the day also, in the night also, anytime it happens.
All right. All right. And apart from this, and is there anything else that is concerning you?
No, that's it.
All right. Have you noticed any abnormal behavior apart from this?
No.
Uh, like What do you do when she does all this kind of stuff?
I just don't know. I just end up getting angry and try scolding her, but I don't like scolding her as well. I don't know. I'm so clueless now what to do.
All right, I can understand that it must be very concerning for you, but we are going to manage that. So, uh, have you ever tried to calm her down and talk to her quietly?
No, I don't know how to do that. That's the thing.
All right, and uh, does she maintain eye contact?
Yeah, she does that.
All right, and whenever she is calm, does she hug you and talk to you properly?
Uh, Sometimes, yeah, sometimes she's very loving.
All right, and mm, does she play with different kinds of toys or the same kinds of toys?
She has many toys.
All right, and apart from this, how is her general health?
She is fine otherwise.
Any kind of fever,
No,
any shying away from light?
no,
All right, how is his bladder and bowel, like poo and pee?
it's fine.
And is she alert and active?
Yeah,
All right. And has she got any medical condition by any chance?
sorry.
Has she got any medical condition?
No, no,
Is she taking any medication?
no,
All right. Is she allergic to anything?
no.
All right. Who else lives with you? Sarah.
Just like Anna's grandmother.
All right. And how is she with everyone?
Yeah, she is otherwise a good relationship.
All right. And so thank you for all the information. Apart from this, would you like to add anything else?
Well, the thing is that it's bothering me. Like I'm not able to focus on my things. I'm also struggling. I'm the only one who is earning bread at home. So I really need your help, doctor. I hope you understand what I'm going through.
Definitely, Sarah. I can understand that you are in a very difficult situation. It is getting troubling. It is troubling you to manage the work as well as your child. But we have all we will provide you support and we will talk about this in detail. And if you need any kind of support, we are here for you also. Okay. So
Okay.
due to all of this, how is your mood?
Sorry. How is my mood?
Yes, yes. How is your mood?
Yeah,
How are you
sometimes it's
coping up
low,
with
but
it?
I'm coping up. I'm managing.
All right. Can you rate your mood on a scale of 1 to 10?
It's around 6.
2 minutes remaining.
All right. So thank you for all the information, Sarah. Uh, I would like to examine your child, Anna, and I would like to check her vitals and perform a general physical examination. Is that okay with you?
Okay. Okay. It's normal.
So do you have any idea, Sarah, what might be going on?
I have no idea.
So, uh, Sarah, the uh, problem that is going on is it's not even a problem actually. So what uh, she is doing is called something called as child tantrums. Okay, basically she's throwing tantrums. Do you know anything about it?
I don't know. What is that? Why is she doing this?
So usually at the age of in which Anna is, they are growing and they want to communicate more with us. And sometimes they are not able to communicate, and that's why they get frustrated and do all this kind of stuff, which we call as tantrums. Are you able to understand?
Okay. Okay. So what is the solution for this then?
So the main solution for this is that I know it's very difficult for you, but you need to show some love towards your child, and sit with her and make her favorite food, and make uh, give him food with your own hands. This will improve the bonding with you, and she will stop throwing such tantrums. Uh, are you able to understand?
Okay, makes sense. I can try that.
Yeah, I know that it must be very difficult to maintain a job and all that, but this is the best for your child, and we also want that for you.
Move on to the next station.
Okay, you have 1 minute more. Carry on.
Okay. So apart from this, uh, I would suggest that yeah, that's one thing you can do. And whenever she throws a tantrum, try to not to give in to her demands. That will calm down her tantrums temporarily, but that may not be helpful in the long term, and the tantrums might even increase. Okay.
Okay.
So yes, be calm with her, and if you need any support uh, and any care, or any care support or anything like that, we are here to help you. Okay. I can give you some leaflets to read about this condition. Okay. And you can find more information on that, on how to manage this tantrums.
Okay. Okay.
Is there anything else that you would like me to address,
Uh,
Sarah?
that's okay. Time is over. What do you think?
I was hesitating a bit in the management part, and his history was also like not organized as I would have liked.
Okay. Okay. What else? Do you think anything you
Okay,
could have
I'm
done better, or you,
good with.
other than this, what you
Sorry.
mentioned? Do you think anything else you could have done better?
Uh, I think that's it. Like the time management is not proper because this hesitation and that is coming. That's why.
Okay, so you are like nervous.
Yes, sometimes.
Okay.
Like in the stations which I don't have a specific pro forma, I become nervous.
So counseling sessions, you struggle counseling sessions, ethics
Yes,
sessions.
yeah, yeah,
Okay.
counseling and all that.
Okay, in which the complaint, like chief complaint is mentioned, that time you know what to do it. You remember things.
Yeah, yes.
Okay. All right. Okay, let's take feedback from the doctors who have been listening. Please feel free to say anything you want. Keep it brief. Anybody who's followed the station wants to say something regarding this?
Hello, doctor. Should we ask child's detail like birth history, developmental history, jobs, and uh, eyes? Like, what do you think might happen in your child?
Okay, what do you think? Word history is important, Dr. Darshit?
Yes, bird is important. I was coming on it, but then I forgot it. Like it was there in my mind, but then I forgot it.
Yeah. So bird is important. Ice, do you think ice is important?
Yes.
Okay, ice is also important. But I think you did cover somewhere here and there. You asked concerns, right? You asked
Yes.
concerns. I think you remember that.
Yes.
Idea also, I think you probably, I don't know if you asked, but ice was
Yeah, yeah.
here and there because in this kind of stations. All right. Other than this, anything else?
Any change in like nursery or school or at home
Why do you want to ask that?
that can trigger the behavior
Okay,
change?
so basically triggers. Okay, so there are some conditions and you have to remember the triggers. For example, risk factors or triggers. For example, child tantrums or in nightmares or bedwetting. So there are some triggers to these things, or epilepsy has happened, fit has happened. So there are some triggers. So in those stations, whenever you read that station outside the cubicle, or whenever the patient they mention the chief complaint, so at that time you should also think, okay, there must be some triggers, let I need to find out that. So in this station, so you need to ask the triggers also. So what are the triggers? One is change in nursery, change in environment. That's good. What else?
Other sibling?
New
Other,
sibling.
okay, siblings, that's fine. New sibling, that's fine. What else?
Loss of any beloved pet or something.
Okay, any
Or
tragedy?
yeah, mother going to work recently.
Yeah, mother going to
School
work. So
bullying?
why is it important? Mother going to work. How is it relevant? What difference it makes in child's life?
Because this might induce separation anxiety in the 3-year-old kid. That's really important.
Yeah, or you can also put it like that mother won't be able to spend much time with the child. Okay.
Yeah.
So
Yes.
the child needs to be loved and spent time with. So if a child is not getting that enough time or enough attention, that is a very, very important risk factor. And usually that is the trigger that comes in the exam. Okay, in this station also, if you would have asked me, I was trying to bring his attention to mother's psychosocial history. He did ask mood, but he kind of again, overlooked mother's occupation, what all she's doing, how much time she's spending with the child. So these are the questions that you must ask. That is what will set you apart from other students, because everybody will explore the fit, everybody will rule out autism and stuff, but finding the trigger in this is the most important thing, because that is what your management will be based upon. Otherwise you will vaguely throw 2-3 points without addressing what is the main issue, why is it happening. So that is the thing that you need to address. So in this, the main trigger would have been from my side that mother is recently started working or stuff, she's not getting enough time. So in the management you should have told me that as you started working, probably that could be the reason, so you should try to make out more time for the child. Okay, so that
Yeah,
is
I
the
think I knew it, but I didn't verbalize it. So I should have acknowledged it by saying it.
so in the history you should have asked. You didn't even ask in the history any recent
Yeah.
change in the job, or how, what are you working at. Okay.
Yeah, yeah.
That's fine. So triggers is the main thing that needs to be asked. So one is nursery, any change in the environment, any tragedy. Okay. Then any is the mother spending enough time with you? Okay, or any sibling. So these are like many triggers are there, but at least ask 2-3 main triggers. Anything else in the triggers if somebody wants to express? Okay, so
Like,
yeah, pets. Okay,
sorry,
all right. Okay, that's
like
fine.
school bullying,
So
nursery.
bullying, yeah, nursery, you can ask, is the child going to the nursery? How is everything at home? That's also important.
Yeah,
Okay, so
yeah.
these are basically psychosocial history of the child, or part of child's, maftosa. You need to ask nursery, important question. Okay, so that's good. So far we have understood that we need to ask triggers in this case. We need to ask bird history. We need to ask ice. That's great. What else we need to do in this station? Anybody?
Danger at home.
Danger at home, like are there ghosts at home? Like what do you mean by that?
Your partner, like is like
Okay.
who,
So
whom do you live with? Yeah.
and so basically she's trying to say NAI. So NAI history is very, very important in all pediatric stations. So she did ask how is the child going with everyone. So that's fine. Probably you could have asked about the biological father, because I didn't mention about that. I intentionally didn't mention. So you should have asked, may I know what about his father? So mostly when they don't mention, so usually it's a divorced condition. So they will tell that I'm divorced with his father and stuff. So you ask that, is the father taking care of the child sometimes? How is the relationship between them? So NA has to be ruled out from all directions. Okay. All right. What else? Okay, so in the history regarding the complaint, so chief complaint was that child was not, is not responding properly, is throwing the plates, or is like this. So what are your thought process? What do you think are the possibilities? Anybody?
Sorry,
So I
what
was
did you
thinking
ask?
about the environment.
Sorry?
I was thinking about the environment, child environment. Does anybody smoke or drinks around the child?
Okay, yeah, you can ask that. That's fine. Yeah. Anything else? What are your differentials in this? Now, my next question is, what are your differentials when I tell you that the child is not responding properly, or child is
Autism.
autism? Okay, that's good. That is one red flag that must be ruled out. That's good. And doctor did it really well. That's great. What else?
ADHD, attention.
Attention deficit. So there is a station coming recently, ADHD, negativism. So these both stations are coming. Okay. So you need to ask this. Is child using any abusive language? Is child attention span, or is he is he paying attention to like different things at the same time, all these things. Okay, or he seems to be anxious or nervous. All right, and then you ask, is he watching any scary movies or all these things that can lead to negativism, okay, or abusive language. All right, or is he being aggressive, is he fighting? So these are the questions that you need to ask, because similar history will present in ADHD, in negativism, and in tantrums as well. So these are the differentials that you should rule out. Okay. Then medical history, fever and stuff he asked. That's good. That can also lead to tantrums. That's great. So history is clear so far. Now let's talk about the management. So what is the management for this condition? How will you manage child tantrums? How will you explain? Somebody tell. How will you explain to the mother what is happening to the child? Anybody wants to try?
Well, can I explain, doctor?
Okay, go on. Keep it brief.
Yeah, so we can reassure the mother that there's no need to worry. It's a condition in this age group that the children, they want to express themselves, but they don't find any other way. So they throw these tantrums.
Okay, so it's a normal part of the development. It can happen around this age when children want to express themselves, okay? Or this is the way of a child to gain attention sometime, okay? That is another way of saying this. But yeah, different ways of saying, but the most important thing is it's a reassurance. You have to give in the reassurance. So Dr. Darshit also said it right. He also said it right. So now you talk
Yeah.
about the management. So how will you manage in this case?
So we will,
Like please, can I explain?
Okay, go on.
Yeah. So when she said, I don't know how to communicate with her at the moment. So, she has to work on communicating with her child, try to spend more time, especially at night, try to tell her a bedtime story, or before going to work in the morning, try to spend some time and, give her a hug and, a toy, or maybe to engage her when she's at work. So I think that's the
Okay, that's good. So what all Dr. Darshit mentioned or you mentioned, that's good. So you can decorate the plates, you can give a night hug, night kiss, and then you can do bedtime stories. You can play with the child, spend time. So spending time with the child would be most important point in this station. Now, this is only half of the management that has been done. What is the other
can
half
I
of
add,
management?
yeah,
Yeah.
can I add something, doctor?
Okay, go on.
Yes, so we can ask the mother that you need to rule out the cause. Just observe your child if he's hungry, if he's tired, because he don't know how to express himself. So you just need to know the reason. If he's hungry, give him any food so that he would be calmed down, and give your time, give your attention. So
Okay.
basically need to rule out the trigger, the same thing you
All
told
right.
us
So you
earlier.
can safety net
Yeah.
the patient regarding this. That's good. What is the other half of management that has not been touched upon so far?
The mother should work on her behavior when the kid does so. She should not shout and react when she does that, and try to manage her calmly in a proper way.
Okay, that's fine. That is also part of the first half of management. What is this another half of management that has not been touched upon? Anyone?
Mother's psychosocial support.
Yes, mother psychosocial. Who spoke it? So
Me,
yeah,
Dr. Darshit.
Dr. Darshit only said no.
Yes.
Yeah. Okay. Now you tell about mother psychosocial management. How will you do that? And is it important?
We'll tell her that if she needs any support, we have got some support, like therapies and all that.
So yes, talking therapy can be talked. If you can mention about that, in case it's really affecting you, we have talking therapy. Okay, you can talk to your community health manager, or you can go to your GP. In case it's really affecting you, you can take help your grandmother whenever you are not able to manage. Okay, and if you need any financial support, we can support you with that. Okay, reassure the mother. That is very, very important in this station. Okay, because unless you really treat the mother, the child cannot be treated, because this is the mutual management. So you have to address the mother management. This psychosocial history of mother is very, very important. That needs to be asked and managed. Okay. Usually we tend to overlook it because we think, okay, child tantrums I have diagnosed, I have mentioned 2-3 points, that's good enough. That's not good enough unless you touch upon mother's psych and mother is happy with your management. It's not right. And don't blame the mother for anything. Appreciate her efforts, whatever she's doing. Just keep her, keep counseling her, for reassuring her, and tell her that she's very strong and all these things, and how she can cope up with this condition, and it's not something unusual. Okay, everybody goes through that. Talking therapy, support groups, leaflets, so all these things you can mention about, but do emphasize at least 1.5 minutes should be spent upon this, or 1 minute. Okay, so is it clear? Both psychosocial childs, we have talked about how to minimize the tantrums, and we have also talked about how to counsel the mother. Okay, there are some support groups, like there is a health visitor. You can talk to your health visitor if you're struggling a lot, or you can visit the Family Lives website for parenting advice and support. So these are some key points that you can mention if you remember. If not, it's not mandatory. It won't make much difference in your score. It just brings little more professionalism. But if you just reassure the mother, well, mention about talking therapy, okay, that's good enough. All right, any questions so far?
I just want to ask about leaflets. Like it's written on GMC side, we shouldn't offer leaflets to the patient. So I'm not sure if, yeah, because it's written like there are no leaflets inside the cubicle, so you shouldn't offer the leaflets to the
We have
patient.
to offer leaflets whenever it's relevant. You can say that I will give you some leaflet. There won't be any leaflets inside the cubicle. Okay. So
Yeah,
now,
that's why I'm asking.
yeah.
There
Okay.
wouldn't be any leaflets, then how
Yeah,
can we
you
offer?
just say, verbalize it, that I will be giving you some leaflet. Doesn't mean that you have to give them. Okay.
Okay. No,
Yeah.
it's written on the GMC website, do's and don'ts.
I don't know about that, but whatever I know, I have given the exam and I have offered leaflets and I have passed those stations. So everybody offer leaflets. It's a usual practice.
Yeah, that's why I'm confused in
Yeah.
everybody
So,
offer and
yeah,
everywhere
you
it's
have to offer.
written.
No, you have to offer leaflets. Very, very important. Okay, so now let's look at the feedback of Dr. Darshit. So in the beginning, he started with grips. So that was good. Greeting rapport was built. He did acknowledge the complaint, provided some sympathy to the mother. Then he moved on to the exploration of the complaint. So what was the main complaint about the tantrum, and about, so he asked, like, is it happening in the morning, in the night? He explored it a little bit. Okay, then he moved on to the ruled out autism. So for that he asked eye contact, toys, is she playing with the same toy, different toy, something like that he asked. Then he did ask some medical history, okay, like fever and stuff. Probably fits could have been asked, because that is something might be confused by the mother. And also safety netting for the fits have to be taken. Then he did ask about NAI history, who is taking care of the child. Okay, then I don't know if he asked any other tragedy. Then I emphasized upon the psychosocial history. I had gave some out of my way, and I went that it's affecting my life as a mother, all these things. So then he asked about the mood. Otherwise, like without that, he should have asked like also psychosocial history of the mother. He was kind of skipping that. So there were few things like in the history he didn't really touch upon. So one is a history of ADHD, negativism. So probably that could have been asked properly. Then bird history, then psychosocial history of the mother. What does she do for living? How much time she spends with the child? Triggers we have already discussed, so that was missed. Okay, so these all things in the history he missed upon. Then examination. Okay, you can ask, is the child with us today or not? Okay, then ideally I would like to examine the child. Then he mentioned the management, so explanation was good. Then he told about the management, so spend time with the child, just 2-3 standard text points. So he mentioned that book points, so that's good. But the main point was spending more time with the child. Like, although you are working, I can understand, but it's more important that you spend more time. Okay, all these things maybe he could have explained better according to the patient. That was then. And then safety netting was missing, in which he have, in the child develop any fever or any fits, or he is not eating properly, please come back to us immediately, we'll follow up. So follow up is also important in this. So we'll follow up your child in 1 month. Okay, so these points were missing in the management. IPS wise, I think his IPS is fine. He did signpost here and there. Overall, he was reassuring the mother. Yeah. So according to the station itself, if I would have looked at the IPS, so if you would have asked psychosocial history of the mother and be little more reassuring in the management, so IPS would have become better. Otherwise, it's like a generic IPS is fine, whatever he did. Any questions, Dr. Darshit?
No, thank you, doctor.
Okay, you're welcome. All right, doctors have been listening. Any questions so far? Okay, so
Doctor, one more question. Can we offer NHS websites?
well, I didn't offer in any station, but somebody told me not to offer that. It's rather like it's not a professional thing to do. You just tell that we'll give you leaflets. That's it. Don't talk about websites. Like in this, like there is Family Life's website which is specific, so you can offer. But otherwise, don't talk about like that. Just say leaflets.
Okay.
Okay, then
you.
we got some comments. What's his score? So I don't score. I'm sorry for that. I don't think anybody is qualified enough to score anyone here. Okay, because it's a very subjective exam and there's no point. What I can do is I can only give the feedback from my own experience. That could also not be enough. So whatever I'm doing is from my own experience, but I don't score. Okay, I don't like to score anyone. Then what about signposting? Is it only in Maptosa, for example, when it is? So signposting is like one is in the beginning, like after exploring the presenting complaint, before you rule out the differentials, do signposting. So just say that, okay, let me ask you some yes or no questions to rule out some possibilities, or let me ask you some question to go to the bottom of this. So that is signposting before differentials. Then before Maptosa, you can signpost, okay, let's talk about the general health of little Anna now. How is she? How is that? Okay, that is if we are sign lifestyle, you can, okay, let's talk about the lifestyle now. So like this is called signposting. Okay, that helps to make your consultation more professional. Then examination management. So yeah, that's it. Okay, so next is we have got yeah. So somebody asked talking therapy again. So talking therapy is basically CBT sessions in which one-to-one talking sessions happen. So this is for the mother because she is going through a lot. I mean, I'm sure doctors who are mothers here. So how difficult it is to deal with a child. So it can really impact your mood, right? So talking therapy can be helpful. So that's why we are offering the mother talking therapy for herself. Okay, now let's move on. If there are any questions, please quickly ask. Okay, so who wants to go for the next station? Anybody with the exam in June or first week of July? Anyone with the exam in the end of June or probably in July? Okay, nobody wants to do the station. I got some text message and I will go with them. So Dr. Faiza. Dr. Faiza, are you there?
Yes, doctor, yes.
Okay, do you want to perform the station?
Yes, please.
When is exam?
14 July.
Okay. So by the way, the doctors who are not aware, so this is my 5-day course. It's very, very concise and to the point. It's starting from June 22nd. If you're interested, let me know. There'll be many recorded sessions and practice correction sessions like this in a closed group of students. Okay, next station is on the screen. So doctors who are listening. Please participate actively, make an approach in your mind, and try to correct the doctor who is performing. We'll start in 30 seconds. Okay. So I'll start the timer now.
Begin.
Hello, I'm Dr. Faiza, one of the doctors here in the A&E. Could you please confirm your full name?
Yes, doctor. I am Mr. Andrew Collum. I'm 22 years old.
Thank you. And I can see that you are here for your son.
Actually, yes. I am here for my son. Actually, his name is Andrew.
All right.
I am Adam, and
All right.
he's 22. And I'm not happy with the care that you're giving me, doctor. I'm very, 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 very like angry, and I want to complain. Actually, I'm frustrated. How can you do like this?
I can see that you are so much worried about your son. Well, we are really sorry if we made you feel this way. So, could you please tell me more about this? What happened exactly?
Well, my child had a fall from wheelchair a few days ago, and I brought him to the hospital,
Mhm.
and he had a bruise on his ankle. Okay, and the
Okay.
team assessed him, and they did something examination and stuff, whatever they told, but they didn't do an X-ray. And just because my child has cerebral palsy, why are you treating my child unfairly? How won't you? Which doctor won't do an X-ray when somebody is fallen on the ankle? It's like clearly a discrimination.
Well, I totally understand that you are quite frustrated about the treatment which we have given to your child. So I'm really sorry about this. So you told me that you think that it's like they have discriminated your child. Am
Yes,
I correct?
yes.
All right. So am very much sorry for this, what has happened to you. It should not happen to you. And I will definitely go through it, that what was the actual cause and why you were treated in this way. Is that all right?
Okay, please.
All right. So is it okay if I ask you some questions regarding your son?
Okay.
So may I know what happened to him, how he fell down, and at what time you bring him to the hospital?
Yeah, like he fell down 3 days ago, and I brought him immediately after that in the emergency.
All right. And and how was the care? Like, did they done any investigations or anything?
Yeah, that's the thing. They didn't do anything. They just touched upon that and told me that it's not an issue.
All
Give
right.
some
Okay. And
painkillers.
I understand. And did they give you any treatment for it?
Yeah, just the painkillers.
All right. And is it effective? Is your son still in pain?
Yeah, I mean he's a little better now.
All right. Okay. And anything other than this concerning you?
That's it.
All right. Okay. No problem. Definitely, we will go through this. What happened? All right. So, could you please mind if I ask you some questions regarding the general health of your son?
Okay.
Right. So, could you please tell me that your son has any other long-term medical condition other than cerebral palsy?
No.
All right. And how you are coping with this condition?
It's fine now. It's managing these on some support and he,
All
yeah,
right. Okay. And is he on any regular medications?
no,
Okay. And is he allergic to some medications or any other thing?
no.
All right. And who else live with you and your son?
It's just me and my son.
All right. Okay. So thank you so much for answering all my questions. So what I'm going to tell you that Mr. Colum, we need to assess your child. Okay. Is that all right?
Okay.
And the thing is that when you bring your child, we have done all the examinations, okay? And our colleagues, they have decided that he didn't need any X-ray of his joints. Am I making sense to you?
Yeah, I know that, but how can they do that? And how can you diagnose somebody without doing an X-ray?
Well, I understand your concern. The thing is that we have examined your son's leg, okay, and we didn't find anything that is causing the pain. All right. So we usually not it is usually not recommended to do the X-rays without any strong indication. Okay. Otherwise, we are just exposing him to useless radiations.
But what if
Am
he's
I-
having some some fracture? How do you know that he's not a fracture?
Well, yes, I understand what you are saying, but the thing is that your son is he got no swelling over the joint, okay, all right, and he's not in so much pain. He's moving that leg, and we are giving him the painkillers, all right.
He's
So
not able
so
to walk now. He earlier in the beginning he was able to walk now, but now he's not able to walk.
well, I see that you are a bit frustrated, but the thing is that we have just given him the painkillers, and we are hoping for him to recover, all right.
Okay.
Anything else you want to ask, my dear?
I just want to complain. I don't understand. Like I am still not convinced by your explanation.
All right. Okay, I'm really sorry that if you are not convinced by my conversation, I can ask my colleague and my senior. They can come and have a chat about your son with you. Is
2
that all right?
minutes remaining.
How does
Okay.
that sound to you?
Yeah, that'll be better.
All right. And the other thing you mentioned that you think that your son was discriminated. So for this, I just want to reassure you that in our hospital, we do have some anti-discrimination policies, okay?
Okay.
And we treat every patient in a similar way, all right? We don't discriminate our patients,
Okay.
all right? So you don't need to bother about this thing.
Okay.
All right, and for the time being, we will book another appointment for you so that we can review your son improvement. Okay.
How long he has to take these painkillers?
Well, it depends on his recovery. For a few days, he need to take these painkillers, and if he feel better, then it's good. All right.
Okay, so what if it is not a fracture, then what it is?
Well, it is high likely that it might be a simple sprain. Okay.
What is
That
that?
he got. So basically what happened then that sometimes your joints, they are a bit overstretched, all right?
Mm-hmm.
So that causes that sprain. We call it as a sprain, all right? So
Okay.
for this purpose, he need to continue taking his painkillers, and we advise him to take some rest. How does that sound to you?
Okay, that's fine. I hope that you would, check my child again once.
Yeah, so definitely I'll check your son once again, okay? And at any time, if you feel that he's still in pain, he's not recovering, or have you noticed any swelling, then straight away come back to us. All right. And
Okay.
I'm really sorry about this. but
Move on to the next station.
Okay. What do you think?
I don't know. I was just going on making some flow. I don't know.
Okay. So do you
Yeah.
think you could have done anything better?
Yeah, I think I could convince you in a more better way if if I add something more.
So how would you convince? So what is your what is the main agenda? Like why the father is angry? Why he thinks it's unfair?
Because he was like there was no X-ray done for his child, and he thought that his son has got the cerebral palsy. That's why they were discriminated. So these two things were, yeah,
So you are saying that X-ray is not needed, right? So that is your
yeah,
thing.
yeah,
So how will you
yeah.
explain to the father that X-ray is not needed?
Well, I can explain like if we see any swelling, or something,
Mhm.
then we can do the X-ray. That might be one of the strong indication. Or if the painkillers are not affecting, he would be still in pain after a few days, then we might do some X-ray to confirm that, to rule out this fracture or anything.
Okay. What are the other indications of a fracture?
Bony point tenderness.
Bony point tenderness. Okay, that's good. What else? So if somebody has a fracture, like, or somebody has a sprain, like, in which situation will the person be able to walk immediately, and later on the pain will increase, and in which situation the patient won't be able to walk at all immediately?
In
In
sprain,
fracture, yes, sorry.
okay. So in fracture, he might move a bit,
Okay.
and afterwards he would not able to move him. And in sprain, I think he cannot move immediately.
Okay. Does everybody agree with this?
It's reverse.
Reverse.
Okay. What do you think? So in the fracture, will the patient be able to move a little bit in the beginning, or no?
No.
No, right?
No.
Yeah.
No.
Yeah, that's what I think also, because in the fracture, there will be a lot of pain. In the pain, usually in the beginning, you might feel, but usually like in the mornings, you feel like the pain suddenly increased, right? That's what happens. So
Okay.
yeah, so in the history, you should ask like what happened, like what is the child, was the child able to walk, was able to move a little bit in the beginning? So history was incomplete, right? So history should have been
Okay.
taken properly. How is it now? Pain, you did mention progression of pain, bruise, progression of bruise. How is it now? Is it getting better, worse? Okay, is the child able to bear weight on the leg or not? So that is also important question you should have asked. Okay, then another important thing that will lead you to decide whether child needs X-ray or not is re-examination of the child. What are the current examination findings? So you should definitely re-examine the child and ask. So father might say, no, my child hasn't come, he's at home. Then tell him to bring him to the hospital. We want to re-examine him to check if we need any X-ray again or not. So examiner will give you findings for that. Okay.
Okay.
All right. Any other reasons anybody wants to present regarding in the favor of not doing X-ray?
Side effects of X-ray.
What?
We can tell side effects of X-ray.
Yeah, that she mentioned, the radiation exposure you can mention. What else? Okay, so I think most of the things were covered. So bony tenderness needs to be mentioned. There is no bony tenderness was. So you say that at the time we did examine and the doctor didn't find any pain on touching the bones, which is unlikely to be a fracture. That's why we didn't want to do an X-ray because it won't change the management. Okay, it's fine. Anyways, I will re-examine your son now. Can you bring him to the hospital? So re-examine the child. So that is the only thing that I think you missed. And you could have asked a little more about the history, like what happened? Was he able to bear weight at that time? Is he able to bear weight now on the feet? So all these questions are also important regarding the bruise.
Sorry to interrupt. Can I ask something, doctor?
Okay, go on.
So how can I ask father about his child who is wheelchair bound?
How can you what?
How can I ask about the son, like who is wheelchair bound? How can he move his leg or something? Can wear weight on his leg? He is wheelchair bound.
Yeah, he's wheelchair bound, but still, so even if somebody is wheelchair bound, they might, stand a little bit, right? They are not always sitting on the wheelchair, so they might move a little bit or might stand. Okay, so you can ask.
Okay.
Okay.
All
So
right.
you ask
All
that.
right.
And
Because I
also,
was trying to ask, but then I thought that he's wheelchair bound. So how can he move like?
yeah. Just ask little bit. Even if somebody is wheelchair bound, they can see whether they can press
Okay.
the wheel or not, something like that. Okay, so just ask.
Okay. All right.
All right. So anybody wants to give feedback in this or say something regarding the performance, good or bad? Any comments, doctors who followed the session?
Yes, since this child is a CP child, should exclude the pain, might not the pain, the child while examining might not express that. So why not the father is asking, expecting X-ray?
So if the child is not able to express the pain, what did you say after that?
Yeah, the father's concern also, he want X-ray for the child.
Father's concern, sorry, I'm very sorry, I didn't hear that. Father's concern of what?
Father wanted to have X-ray for the child.
Yeah.
Yeah, since the child is not a normal child, and
Okay.
examining, child might not appreciate the pain while examining, to exclude the fracture. Why not X-ray can be done?
Okay, so that is what father will ask us, or you are speaking in favor of doing X-ray.
Yes.
Oh, well, well, that could be the reason that the child is a cerebral palsy. Maybe he is not expressing, the examination is biased, probably. But at this point, like there is not just one instance, so you can like call the child, examine again, and also at the same time, you have to ask other questions as well. And his pain is getting better now. Okay, he is improving. So there are many other factors also which leads to the fact that he is getting better. So just the examination finding, and that is not every cerebral palsy person who comes. We don't assume everybody is not able to express their findings. So we don't do X-ray for everyone. So that's not necessary. Just tell that every child is treated. So say use these terms like this in this station, that this is the IPS you need to see. That we see every person in the same light. Okay, although he has cerebral palsy, but that doesn't make difference for us. For us, every patient is the same, so we treat everybody with the same amount of compassion. So just use that kind of language, and don't think too much about it. You don't have to speak in favor of doing X-ray. You have to stick to that examination finding and tell that X-ray was not required. It's unnecessary exposure to radiation. That's it.
Okay, thank you.
All right. So anything else? Okay, so I think overall, Dr. Faiza she did quite well. I think she did in the beginning, her consultation was quite smooth. Few things were missed, but that's okay. So she started by like I told her about the child she's having. So she did, I'm very sorry. I can see you are frustrated with this treatment. So she acknowledged the anger. That was really good. Okay, instead of not acknowledging. So she did acknowledge properly. Then she moved on to the next step, which is let me ask some questions about your child, all these things. So she did ask some questions also. Then she gave the explanation why X-ray was not done. So that also she explained well. If she would have done the examination and asked a little bit on the history regarding the progression of the bruise, and if the child is able to bear weight, so then it could have be more like could have made more sense. Okay, but whatever she said was fine. Then she talked about, I don't know if I mentioned that I want to complain. So you have to talk about pulse. Okay, if she didn't tell about pulse, you have to tell about if the patient wants to complain. Okay, and you can also say that I will talk to my colleague as well who saw the child, like why he didn't do the X-ray. So that also can be done. Okay, to see what was his reasoning in case something else. All right. So the only those 2-3 points were missing, but overall, I think IPS wise, in which mainly the patient is angry and patient feels that it's unfair system. So in that sense, I think she did fine. And regarding the cerebral palsy, also she did ask, is the child getting enough support? So that is also good IPS point. Okay. So overall, I guess it was fine only. Any questions? Yes, pulse, like I've just told Dr. Joy that we have to mention about pulse if the patient wants to come, otherwise not. Any questions, anyone? So, yeah,
So, doctor, sorry,
go on.
can I ask, so how can we ask the father, like, how can we, I mean to say, like, how can we tell the father that we didn't find any bony tenderness?
So you say that usually, when we examine the child, we see if there is any pain on touching the bony parts, okay? But in your
Okay.
child's case, we didn't find any such thing. So which leads us that there's less likely chance that the bone has broken. Okay.
Okay. All right. Okay. Thank you.
Can I ask a question? Hello.
Yeah, go on.
You know, in this scenario is written that the patient is CP, but I'm not sure if I should ask from the father why he is wheelchair bound, or I'm understand from my note that your boy is cerebral palsy. Which one is correct, really?
You don't have to start this station like that. So just start that. How can I help you today, Mr. whatever his name? Okay, so you will say, I'm from here for my child. Okay, can you tell me what happened? Or you can start like, I can understand that you have some concerns regarding your child. What happened? You don't have to talk about cerebral palsy at this point. So the father will say that, only if just because my child has cerebral palsy doesn't mean that he should be unfairly treated. So you don't have to bring up the point of wheelchair or cerebral palsy. Okay, he will say everything. So you just have to hear the story.
Okay, if he just says that my child was on his wheelchair and did fall and did not say anything about his condition, maybe in the past medical condition he will tell me. Yeah.
Yeah. He will tell. That is why he thinks unfairly. That is his main concern. So if he won't tell that, then what will he
Okay.
tell?
Okay. Thank you.
Yeah. Well. Okay. Anything else, Dr. VJS? Your hand is raised. Do you want to say something? Anybody wants? Yeah.
I was just no, sorry, Doc. Thank you for the cases. I was just volunteering if there is another case to practice. Sorry.
It's fine. You can probably do in our next session. You just text me on WhatsApp. I will record your name. Okay.
Okay. Thank you. Thank
Yeah.
you.
Well. Okay. Any other concerns? Anyone? Any questions? Okay, so we did 2 cases today. The first case was pediatric case, child tantrums. So in which we looked at the detailed history of tantrums and the triggers. Okay, there are some cases in which you have to ask triggers. So you should know, for example, in epilepsy, somebody is coming with follow-up seizures. So you should know why he's getting seizures again and again. So triggers of seizures, you should know. So one is that you have to ask differentials, but at the same time, you should also ask the triggers. For example, or risk factors. For example, UTI. There are certain risk factors that can lead to UTI. So you need to ask that as well in the history. Okay. So risk factors or triggers. So we looked at that for tantrums, and then we looked at history of pediatrics, birth history and stuff, all those things. And we looked at the management. In the management, there were 2 level managements. One was the child's management, how to deal with the child. Second is the mother's itself psychosocial management. Mother herself is struggling a lot. So we looked at that. So both things are important in this station. Okay. Then next station we did was an angry patient because he thinks that his child is being unfairly treated. Child has cerebral palsy and is wheelchair bound and had a ankle sprain, and X-ray was not done. But the father thinks X-ray should have been done. So we looked at the reasons why X-ray was not required. So for that, we have to prove the point that why X-ray was not required, because there was no bony tenderness on examination, and the child was able to bear weight like immediately. After that, the pain increased. So that is also another another factor unfavorable for the favorable for the sprain rather than the X-ray, rather than the fracture. And then, of course, we will re-examine the child. That was not done by doctor, but we have to re-examine. And for that, we have to call the son to hospital again in case he's not with the father. And we have to tell, and then examiner will give you the findings in this station that everything is same as mentioned regarding previous and swelling or bruise has come down. He will give some findings in favor of not doing X-ray. Okay, that is another point which you can tell that why X-ray is not required. And of course, last point is that it's an unnecessary exposure to radiation. And the IPS in this station would be, one is that you have to absorb the anger of the father by acknowledging it and by giving appropriate reasons. Secondly, for him thinking that it's an unfair treatment, so you will tell that why as a doctors, for us every patient is same, so you have to clarify that we see every patient as same. It doesn't matter if he's any past medical history or not. Okay, so that is how we work here. So that is another IPS you have to give. So this is about today's free session. So I'll also share the recording if you want to hear it again. And this on the slide you can see is my next session, PLAB 2 intensive 5-day course coming up. It's been really helpful for many doctors have passed in this. I've conducted many batches. So I'm conducted from June 22nd. In that, there will be a lot of recorded sessions. Okay, there will be a lot of mock recordings, and there will be a lot of sessions like this with a closed group in which you will get to practice and get a detailed feedback from me, as well as hear others practicing. Okay, so it's just a 5-day course, and it's a very, very concise and intensive packed course, and it will really set you in the right direction for the exam. It will hit all these 3 domains: data gathering, management, and IPS as well. So other than that, I have some private mocks as well, 1-to-1 mocks, which mostly are booked for, of course, June is booked, and July there is some slots available. So if you are interested, you can let me know regarding that. Thank you so much for joining. Please share feedback in the groups. It was helpful for you, and we will hopefully conduct another session in coming future, probably next week. Thank you so much once again.